apologize. I don't know. So let's continue from where we left, right? Okay, so really important that you understand them. Somatization, as I told earlier, is when the patient has no symptom, right? He has symptoms, but everything else is against what he has, right? Then there is hypochondria, where the person would have like a serious underlying disease. He wouldn't just say, he's got a headache or, some knee problem. He'll say that he's got some HIV, some cancer, etc., etc. Okay, conversion is when they're feigning the symptoms, meaning they don't have the symptoms or anything. They're feigning it in order to gain something from it, almost to gain something from it, right? So this is backed up from some studies, but the patient doesn't consciously feign it. In malingering, the person's consciously feigning it in order to gain something. That's your malingering. This conversion disorder, the person would just unconsciously have it. For example, a person goes through something big, right, a trauma or something, then they start to stop speaking, right? You've seen those movies, right, where the person saw a ghost and they couldn't speak forever, right? It was like a long time that they couldn't speak. That is your conversion disorder, that they do not feign it, but something so bad happened that they started having these symptoms. I hope I'm making sense, and I'm hoping that this is understandable, right? The patient's indifferent to the apparent disorder, right? They don't think they have the disorder. They don't know if they have the disorder, all right? Then there is dissociation disorder, which is separating off certain memories from normal consciousness. For example, in contrast to conversion, right? In contrast to conversion, involves psychiatric symptoms. For example, they have amnesia, fugue, and stupor, right? Can anybody tell me what's fugue? Or is this like when we don't know things, we just say this is spelling error. Loss of awareness, right? Loss of awareness of one's identity, right? They don't know where they are, right? And they don't understand the environment, right? It could happen as an epilepsy, right? Like the patient doesn't know where they are, right? Or what they are or who they are, right? Like, you have seen those films where a person wakes up after an epilepsy or a loss of consciousness, and they say, where am I? Main kahan hu, main kaun hu, right? I hope you understand that if you guys know Urdu, and if not, then in English, where am I? Who am I? Right? That is your fugue, that they're dissociated, right? They don't understand. They lose consciousness for a while, right? They might have amnesia, might have fugue or stupor. I hope you guys are following. This is making sense. Anybody understanding and following? Because it's important, because we're going to have lots of questions on this in the next coming questions. Everybody following me? Is this making sense? If it is, I'll move forward. I hope it is. Can you guys hear me properly? Good, great. Okay, then there is Munchausen's syndrome, or Munchausen's syndrome, where it is a factitious disorder, meaning that the person would produce things on, their own. They would intentionally have the physical or psychological symptoms. How is it different from hypochondria? That the person would be having big things, right? Like, for example, HIV and cancer. How is it different from somatization? There, the person would have symptoms for real, right? For real, they would have symptoms. For example, you have absence of your knee jerk, right? That's kind of a real thing. This one, the person would fake it, right? That one, the person really has it. That's somatization, right? Okay. Then there is malingering, as I told you, just to, like make symptoms in order to gain something. I don't know if you guys know of the case that happened in Islamabad. The guy cut off the woman's head, and now they're just, feigning mental illness. That is what usually happens in, court cases and criminal activities where there is malingering. I hope you guys are following with these weird and good kind of examples. I hope you are understanding. Then there is hypnagogic. Right now, how do you remember gogic and pompic? Can anybody tell me what is the difference between hypnagogic and hypnopompic? Even though it's written here. Meaning, see, pompic is when the person is waking up, right? Pompic is when the person is waking up. Hypnagogic is when the person is about to fall into sleep, at the brink of falling, right? So hearing a voice calling one's name, right? The same thing if happens when they're waking up is pompous. Now, how do you remember this? You are pompous. Do you guys understand the word pompous or pumped? Right? Or pumped. Just want to make you remember this. Pumped, right? Just remember the word pumped, meaning fueled with energy. When you wake up in the morning, you are fueled with energy. So you don't have to forget this, right? Pumped up in the morning or pumped up in the morning, right? Like not especially in the morning, but when you wake up, most of us, sleep in the morning and get up at night, so you can be pumped by that time because you're doctors, right? So you work 24 hours, 48 hours, the feeling, right? But you're pumped when you get up, right? So when the symptoms happen at the brink of getting up, that's pumpic. But when you want to just go into your bed, right? Go to bed, go to bed. When you're about to go to bed, that is your hypnagogic. I hope this was helpful in understanding. Didn't get a dissociative one. Okay, now I'm going to make you understand that one again, but first let's look at this, right? Somatization, the person would have symptoms. Hypochondria, they'll think of something big. Okay, now dissociative, can you read it for me, Dr. Sadaf, I think. Can you read this for me? Dissociative disorder. Can you open your mic and read it for me?
Yes, it's Sadia.
Yeah, Dr. Sadia, sorry.
Okay, dissociative disorder. The dissociation is a process of separating of certain memories from the normal consciousness. In contrast to the conversion, it involves psychiatric symptoms, for example, amnesia and stupor and fugue.
Yeah.
Okay.
Yeah.
DID is a new term for multiple personality disorder, as it is the most severe form of dissociative disorder.
Right. Now, you see, you've been watching all these movies. I don't know if you watch these weird movies where, there's a person who pretends to be someone else, right? And they don't even know. And, this is where most of the material for Hollywood and Bollywood comes in. I tell you this because, this way you would remember and understand. So there is one person who pretends to be someone else, right? This person is in stupor, right? Or there's a person who doesn't remember who they are, right? Okay, so separating off certain memories, meaning a person doing one thing, there is one person and he doesn't, if you guys go and Google the idea, you'd find so many fascinating things. Right now there's this person who's got 12 personalities, meaning and each of the personalities don't know what the other personality did, right? For example, Dr. Sadia, if you are like having dinner with a friend in the morning, right? And your name is Sadia. Now you, the same person, go to lunch with another person in the afternoon, but you change your name, you change your accent, you change everything about you. You're the same person, and the other person, like you being the one who took dinner, doesn't remember that. That is you being dissociated. One person not remembering any other things, right? Normal consciousness, separating of certain memories from normal consciousness, right? Like you would not remember things even though you did things, and you just cut yourself off of those memories even though you made them. So amnesia. Fugue, meaning I told you just now what fugue was, that you don't remember, right? You don't remember your own identity, right? You are not aware of your identity. You understand now, Dr. Sadia? Is it clear? Okay, great.
Sorry, hello.
Yeah. Yes, Dr. Nigma.
Sorry, one quick question. Is this dissociative disorder and conversion is the same or it's different?
See, in conversion, you would have symptoms which are mostly physical, right? Which are mostly physical. Okay, when it is associated with your head, when you've got your psychiatry involved, when you have your mental health involved, then it turns out to be your dissociation. Okay, where you would have your amnesia, you would have your fugue, many other symptoms, right? You would have hallucinations. But in conversion disorders, the things that happen are mostly physical. All right, I'm hoping this was understandable and kind of helpful. Hopefully. I might be wrong in most of the things, but please do Google them, and I'm here to say that what I said was all right. Okay, this is also important. I'm going to give you like 10 minutes to, not 10 minutes, that was bad, 20 seconds. 20 seconds to, do this, because we have to remember these. And then I'm just going to stop talking, and then you'd all be just doing the questions, because, we're done with the basics. should be honest, right? So you're saying this is nihilistic hallucination, delusions. All right. You know what somatization is, you know what hypochondriasis is, you know what conversion is, right? Nihilistic delusion and capagraph, right? So you're saying it's nihilistic, where this person says that, he says he's no longer alive and he wants his family to bury him. Okay, that's your nihilistic. That is your nihilistic. You guys are saying it. Let's see if that's true. That is true. A delusional belief that the person has died, and he no longer exists, and he wants people to bury him. Now, these are important, and I want you to do one thing for me. Take a paper out, right? One single paper. Your psychiatry should be not more than 2 paper long note, right? Like you should just be making 2 paper or at maximum 3 paper notes for psychiatry. That is it, nothing else. All right, nothing else. That's going to be all your psychiatry. So let's start from the very beginning. This is important. I hope you guys are paying attention. At any point, if you don't understand things, please let me know. You could raise your hands, right? This is about to get serious. I really love psychiatry, even though nobody would want me to be one. But because, almost half the psychiatrists become crazy. And that's true, because, you deal with people and you don't really remember if it's real or not. Okay, so I hope you guys are following. Jokes apart. Nihilistic. Nihilistic. I hate the pronunciation. It is nihilistic, right? Nihilistic. Now, what does this word mean? What does this word mean? Nihilism, right? Nihilism. Okay, this means everything being meaningless, right? An embittered nihilistic teenager, meaning they do not believe in anything. They believe that life is meaningless. They don't believe in religion. They don't believe in moral principles. I hope you guys are following, right? Nihilistic person, right? Nihilistic person, meaning that they do not believe in anything. Now, when it comes to psychiatry, this person would believe that everything around him is fake. Everything is ended, right? You see, the person feels that everything is ended and whatever is around is not real. If you read it, it says that is the delusional belief that patient believes that everything that is around him is unreal. It's not real. Nothing matters anymore. The patient has no interest in continued effort, right? So you need to write one thing in front of nihilistic delusions, that is not real. No real morals, religious beliefs, meaning everything around is having no point to continue, okay? And in psychiatry questions, you would see a person who wants themselves to be buried because they are no longer there, okay? They are no longer there. Second is Cotard, right? What happens in this one? That the person has depressed mood with nihilistic delusion, meaning in the first one, he said that, everything around is not real. In Cotard, what happens? You see Cotard. I think it was named after a person because I don't think there is a meaning to this word. But this one says that he's so depressed that he feels like everything around is stopped, but he too is unreal. He too is dead. He is dead. She is dead. Everything around them is rotten, right? So with Cotard, what I want you to remember the word Cotard, everything rotten, right? Cotard, okay? Everything rotten, and they are on the cot, okay? Cot meaning they want to be buried. They are dead on the cot, right? That's how you'd remember it, because it's, I'm telling you, please write these down in front of your notes, because you are going to forget this, because everything would be, just mixed up in your head. So I really want you to write what I'm telling you to write. Cotard, cot. I hope you guys know what a cot is, right? It's like a bed, but very simple, okay? The ones that you see in Southeast Asia, okay? So combination of nihilistic plus depressive, as Dr. Bervin writes, but in this one, the person feels like they're dead and, everything inside them is rotten. In nihilistic, people or everything around them is rotten. In Cotard, the person themselves is dead, okay? Delusion of guilt, you guys should have it all the time. I'm sure you guys are all right. Cotard is graveyard. That's good. Whatever works for you, Dr. Nigma. I'm just telling you what I think. Good, Dr. Nigma. Okay, Dr. Nigma. Okay, now guilt. I know you guys know what guilt is. If you don't know, then you're not a medical student. I hope you guys know what a guilt is, right? Are you sure you understand what is guilt? I hope you know. Do you guys know what's guilt? I hope you do. Because if you don't, then I feel like Neil Hill stick, that everything around is fake. Like you guys are not real. Because if you're not guilty, then you're not a medical student. You should be guilty. Because even if you study all the time, you feel like you haven't studied, right? Or then you start procrastinating. Okay, delusion of guilt meaning what? Now, this is not going to be a small guilt. That means this guilt is going to be, something big. Meaning, COVID-19 was caused by any of you. If you start to feel like that, then, meet me after 5 years. I'll tell you, okay? Meet me after 5 years. I'll be diagnosing you with something. Till then, try and be alive, okay? Okay, COVID-19, if you feel you caused it, or if you felt like, you bombed the neighboring country, even though your government did it, like you being responsible for something big, and you deserved to be punished for your sins. Okay, that is delusion of guilt. And most of us have this at times when we feel like everything that is going wrong in our life is because of us, right? Everything that is going wrong in his life is because of us. Do not do that to yourselves, right? Okay, don't do that to yourself. It's not you, it's the people around you and the circumstances that there are. Okay, so don't have that guilt, but I hope this was, helpful. Secondly, there's illusion of control, meaning this is when a patient has a false belief that somebody else is controlling their life. Okay, their feelings, their impulses, their behaviors, right? That a group of people, right? False belief that a group of people, another person, external force, has control on one's general thought, feelings, impulses, or behavior. This is when you guys are in love. Okay, this is when your mother controls your life, and that's what you think when you were in teenagers, but in reality it wasn't so, right? So you had the delusion of control that somebody else is controlling your life. Or when you you see those aunties or your I'm going to say this, your mothers or your in-laws, when they feel like somebody else has done this black magic, right? Because that's when they start to feel, I know these are weird examples, but I want you to remember and have them ingrained in your head that that's when they feel like somebody else has control in their life, maybe a ghost or so. So delusion of control, somebody else has control over your life, which is incorrect for a real person, because a real person knows that I'm in charge of everything that's around me, my thoughts, my feelings, my impulses, my behavior. Somebody else, if they have control in your life, then you're deluded. Okay, I hope you guys are following this. Is this making sense? Is everybody following? Anybody lost at this point? Or if my examples are too weird, please let me know. Good. Then there is illusion of reference, because after this, I'm not going to talk unless it's necessary, because you're going to go and do your mock kind of questions. Almost everything is covered here. Okay, next thing, delusion of reference. Okay, this is when you feel like that okay, all right, Dr. Vachan. So this is when you feel like that the person who is an anchor or a big personality, or Trump, okay, he's a big person, whatever he does is for you, okay? And this is your belief that if he says, back in the day, because we don't remember the current president of USA, he's born, we don't even know his name, he's not doing enough to be remembered, okay, or to be commemorated, or to be celebrated, or to be spoken of. He needs to do something. Okay, so Trump is a good example, right? That person, if he comes up and does a speech, right, about North Korea or something else, and or when you're in family gatherings and one or two cousins of yours are just talking to one another, or somebody that you hate is talking to someone else, then you feel like they're talking about you, right? This is when you feel like you're important when you're not. In reality, they're talking about something else, but you feel like they're talking about you. Delusion of reference, meaning somebody is referring to you when in reality they aren't. In here, this would be when a person sees things on the TV, on the billboards, and they feel like it's pointed to them, right? Like, for example, there are TV commercials where they say you apply this cream or this lotion or this serum, you're gonna get brighter and prettier. That's untrue. That's not for you, okay? Don't do that. All right, I hope you guys are following. Next is erotomania. Now, this is when they feel like somebody is in love with them. This is usually, how would you know this? When you feel like the crush that you like is in love with you, when in reality they are not. Okay, I'm giving you these examples because, we are still in our 20s, and I guess we can, 20s or 30s, and we can still enjoy these, all right? So I'm giving you such kind of things in helping you understand. Erotomaniac is stalkers, right? All of us are stalkers because we had COVID-19, right? All of us are. But this is when we feel like somebody big, right, is secretly in love with us. For example, if Hugh Laurie comes in or Harry Potter comes in and they, and I see that, he's just talking about someone else, but in reality, it's for you. Okay, I hope you guys are following. Then the grandeur one that we did right now, that you're a big person, you're famous, you're omnipotent, you're very wealthy, very influential. Every politician has that. Persecutory delusion, meaning that when someone believes that their life is being meddled in a harmful way. Again, think of aunties, right? Yes, I had that. Thank you so much. Thank you so much. Right. So this is, when the aunties or somebody else feels like, somebody else is meddling in their life. So persecutory delusion, meaning that somebody else is trying and meddling in your life. How is it different from delusion of control? That one is when you feel like they can hear your thoughts, they can hear your emotions, right? That's your delusion of control. Persecutory meaning that, somebody is having intense hostility. When they feel like they're being tormented, followed, or spied, that is your persecutory delusion. Now, these are the weird ones that I want you to remember. Frigoli is when one person, remember this, because this is important and you forget this, okay? So it feels this frigoli or frigoli is the one where one person feels that different individuals are actually one, okay? Different individuals are actually one who change the appearance or is in disguise, right? Different individuals are actually a single person who changed the appearance or is in disguise, right? Understand? One person, different individual is one person. Claying is when, they try and make rhymes, right? Okay, when systemic, symbiotic, empathetic, genetic, right? They are, claying is, the way they'll start making relations between the sounds and the words, and they would have mania of flights, right? Like right now, I'm just talking and talking and talking, and sometimes I like rhyming. So that is your claying association when you're rhyming with poetry. Okay, Othello. I don't know if you guys read Shakespeare, but Othello is, basically where this syndrome is the one where the person is jealous, right? And they are having this unshakable belief. Delusion is what? It's an unshakable belief, right? Some beliefs are what? They can be changed, right? Delusion is an unshakable belief, meaning that you cannot shake it off of this person, okay? If you believe that today is first day of 2022, right? 2022. No, I don't know how to say that yet. But 2022, that's the first day of the year. Today's the first day of the year, right? That is true. But if you have a delusion would be what? That you believe, no, it's still 2021, right? Or 2019. That's a delusion that I cannot shake it off of you. If I give you the calendar, if I show you everything in the solar system, still you don't believe it, that's a delusion, right? So in Othello, a person feels like somebody else, their partner especially, is committing adultery, they're cheating, they're having an affair with someone else. So I'm not going to say anything about it. Next question. Not next question, next term. Capgras. This is, now you see the first one that we did was Frigoli. This is in contrast to that. So I would want you to write these two together. Frigoli and Capgras together. Is a type of delusion misidentification in which the person believes that an individual known to them has been replaced by a double. You see what this is? This one says in the first one, different people are one person, right? Frigoli is different people are one person. How do you remember it? If you keep on saying it in your head, Frigoli is different people are one person, right? Different people are one person, okay? And Capgras is that an individual known to them has been replaced by a double, right? Who is identical appearances, but is not the real person. Meaning, right? Meaning, if, For example, you feel like that your dad is not your real dad, right? This is someone else. Okay, one person has been replaced, right? They've been replaced. Okay, they're one person, but they've been replaced. Okay, then this Willisig bomb we did when the person had restless leg. This one is again the same thing, but this is delusional parasitosis. It's still the person's gonna feel like that they've got something, some insects crawling on them. If you watched the Conjuring, etc., you must have seen it. Okay, then there's Janser. This is also important. How is it different from the ones that we did? Here, the person has psychic illness where they consciously behave as if they have physical or psychic illness, right? They don't really have the disease. How is it different from melindrin? That in melindrin, the person intentionally makes up the symptoms, right? Here, those are in melindrin, they make symptomatic symptoms, right? Like physical symptoms. In Janser, they mimic psychic illnesses, right? Psychic illnesses, all right? How is it different from the things that we did earlier? When we do questions, that's when you get the questions answer, right? So this is also really important because this is in line with the ones that we did earlier, where we did, melindrin, Janser, right? And also somatization. So do write them in line together and we'd get to see the answer. Then Todd's syndrome is when you feel like, you've got distorted shapes. You feel the patient seems like, their body's expanding or getting smaller. That's Todd's. That is for Alice in the Wonderland. You have to find a way to remember it. This last one is my favorite. This is folie-à-deux, right? Folie-à-deux, meaning one person in love with another person, they start to have the same kind of thinking, okay? They start to have the same kind of thinking. Once they're separated, everything else falls into place. Just think of two people in love, okay? Folie-à-deux, menace of two, right? Two people in love, or two people or friends, they almost have the same kind of likings, right? But once they break up, once their friendship ends, right, and they're separated, they start to feel like, no, that chocolate wasn't the best of the chocolate, right? Okay, or Paris is not the best place to visit in the world. There are other places to go too. Have you guys followed and understood it? Because we're moving to the questions and you're going to do it. You want me to give a quick brief of each. As we go along with do it, mini summary, nil hill stick, right? Nil hill stick, meaning that the person feels like everything around is fake. Cotard, meaning they are fake too, they're dead. Guilt, meaning that, they've got something big, they caused something big. Delusion of control, meaning somebody else has control in their life. Delusion of reference, meaning that, everybody who comes on the TV, everybody on the billboard is talking to them. Erotomania means that they're stalkers and they feel like, somebody big, some big personality is in love with them. Delusion of grandeur means that, they are someone big, they're wealthy, they're healthy, they're influential, which is true, which is what I feel at times, and I'm sure you do too, okay? Then persecutory, meaning that somebody else is meddling in their life, right? Frigoli delusion is the one where you feel like different people are one people. Clang is, like right now when I'm trying to rhyme and it doesn't turn out to be fine, right? So they're talking a lot and they try to make sure that every word rhymes, and they are in this episode of mania. Othello, meaning that, somebody is cheating on them, because that's where what the play is based on. Catgrass, meaning that, that the person's been replaced by someone else, and in reality they're not the same person. Egg bomb, meaning that there are parasites, right? Jensen, meaning that they are just faking some psychic illness in order to get their ways, which is almost melindrin, but here the person would be having psychic problems. Thoughts is the one where, you feel like the body is out of shape, or, something is offending. This is usually, like the young woman, they feel like, they're fat. Okay, I do too. Folie-à-deux, meaning two people have the same kind of beliefs, and once they're separated, those beliefs shake away. Okay, I hope you guys are following. I spoke a lot, maybe spent around 20 minutes on this. Okay, good. Now, you guys are almost ready. I'm going to give you 30 seconds to do this question. So this is important, where you want to know when to pick what, right? If a person has an MI, you're going to pick up citalopram or sertraline, dependent. The other ones you won't pick because, they cannot help in an MI. Okay, so understand that. Next question. Let's just do a little bit of PTSD. Very, very important. Now, what happens in PTSD? In PTSD, the person would want to, what? He's going to avoid things. He's going to avoid the, everything that is linked with those situations, right? Avoidance. That's number one. Secondly, this person is going to have flashbacks. Understand this. I'm not just saying because I want to read it, because, this way you would remember things, because we're going to have questions, right? Okay, flashbacks, nightmares, you're going to have that. Okay, how do? You're just going to give them CBT, right? Or maybe exposure therapy, right? Like, you're going to just tell them, this is going to happen like this. Consequently, you're just like exposing them to that particular event, talking about it in bits and, chunks. Then adjustment disorder is when, the person is incapable to adjust because of a major event in life, maybe somebody's death. And usually it takes around 3 months. However, it could go as long as 6 months. Okay, so it takes 6 months to adjust into anything. Okay, 6 months. This is why they say that, any exam that you want to prepare for, at least give yourself 6 months. But it's not good for doctors. Next question, and I'm sure you guys know the answer. Yes, what's the answer? Isn't it simple? 31 in the clinic complains that she has had episodes of hearing music, and dangerous voices. She's having hallucination. Is it delirium tremens? Is it Wernicke's? Is it Korsakoff? Is it alcohol cerebral degeneration? It's been 2 hours. Should be hallucinations. Let's see if that's true. Right? Look at the time duration. You're never going to get it wrong. Okay, drug intoxication. Next question. I'm sure you'd get this right. For stress disorder, PTSD, fluoxetine, because it's an SSRI, right? Okay, we have to start with medications there. This is almost exactly same from Bible. So, this person's saying that, she wants to hurt her baby. So CBD wouldn't help, fluoxetine wouldn't help, sertraline wouldn't help. We have to go for electroconvulsive therapy because she's psychotic, right? And we've done this before in OBGYN. Next question. Okay. Munchausen's by proxy means that, Munchausen's means that somebody fakes an illness, right? They're trying to produce some symptoms, they're faking an illness, right? But by proxy meaning that they bring someone else, they make someone else be, having the symptoms, right? So like for example, a mother brings a child and the child has nothing, and she has had many visits. There'll be usually a history of them visiting many emergency departments, right? And the mother would say that the child's got something, in reality they won't. Somatization meaning that they have had a shock or something, and because of that they start to have symptoms. Somatized, right? Soma is cell or body, so the body has those symptoms. What is conversion, guys? What's conversion? What's conversion disorder? We just did it right now. Can anybody tell me what's conversion? What's conversion? Quickly, at 20, we have to take a break for namaz. What's conversion? Loss of motor or sensory? Is that real? Is it fake? How is it different from somatization? Real, right? Real. Okay. Okay. Somatization, they have symptoms. Conversion, loss of motor or function, loss of motor or sensory. So conversion usually would have something sensory there. Hypochondrial meaning that, they'd have big diseases. Munchausen's, we just saw that, they're going to have to fake something, which in reality is not there, just to seek attention. Okay. So what do you think this is? Is it hypochondria? Is it something really big? It's usually something Jews. Okay. So you guys are saying it's for it's somatization. Let's see if that's true. It's conversion. Underlying tension regarding her musical career, which is manifesting itself as apparent limb weakness, right? She has took something to the heart that made her have the symptoms. How do you differentiate between somatization and conversion? We just did it. See, in somatization, there's a criteria that they should have multiple. Please write it down. Please write it down. Please remember this, because that is all psychiatry there is. You're going to have these questions only. Nothing else is going to come in this, right? So multiple physical symptoms, not just one, multiple physical symptoms, at least 2 years, long history, multiple physical symptoms for 2-year long history. Conversion, this person had loss of motor. She couldn't pick up her arm, right? The patient doesn't feign it, right? He's not trying to gain something, but they don't understand that, there has been, some problem. They wouldn't understand it. right? So loss of motor or sensory function, they don't feign the symptoms, right? Symptoms. Yes, Dr. Sadia, so many symptoms, right, guys? Okay, you know what Munchausen says? That, you know, factitious, they are having intentionally these symptoms, right? Malingerant, when they want to get something, they're being fraud. Okay, please don't forget these. We're going to do next questions. And at 20 question, I'm going to take a 5-minute break for namaz. Which medication causes hyponatremia? The only medications that are really important in psychiatry, they cause hyponatremia. That's why they want you to remember it. SSRIs, right? So you guys are saying sertraline. I just see 2 or 3 people replying. Is it difficult? Because if it is, please let me know. I'll just keep on talking and make sure you guys understand. Sertraline, all right? Sertraline, SSRI. Let's see if that's true. That's right. SSRIs cause hyponatremia. That's all you have to remember. Okay, please write it down in bold, big words. Not one. See, now Echo. She's complaining that she's unable to think properly because the nurse is sealing her thoughts, withdrawing from someone, taken away from someone, right? Thought block meaning somebody is trying to block the thought. Broadcasting meaning whatever you think, everybody else can listen. Thought insertion means somebody else is putting ideas into their head. Thought echo meaning that, you know, somebody else can read their thought, listen to their thought. It's stealing, withdrawal, right? The nurse is doing it. The nurse is very unlucky. Yes, Dr. Hamza, difference between echo and broadcast? What do you think should be the difference? Any idea on your own? Because, you know, these things you already know. See, echo meaning that when the person hears his own thoughts, he feels like, you know, he's saying them out loud. Okay? They feel like they've been saying them out loud, which they haven't, right? Okay? Right, like, you know, when a person is playing chess, right, they're thinking of a move, then, you know, if they feel like the other person can listen to them. Broadcasting meaning that everybody else can listen to it. Okay, there is a difference. It's not like they're saying that out loud, but everybody can listen to the thought. Okay, which one's this? Barely pauses to speak. Pressure speech is what you're saying. Very right. Okay. Yes. Perforating nasal septum, because you know they are snorting it. You snort the cocaine. Lithium cause tremors. Oh, so we're going to take a break of 5 minutes and then we're going to be back. Or can we do 10 more? Should we do 10 more? Or do you guys want break? Because I need to pray. We're running out of time, I guess. Let's do 5 more, right? Let's do 5 more. Here we're saying 5 more. Okay, just 5 more. Let's just cut in between. Okay, this is delirium treatments. No, we're not going to do 15 minutes break. I really need to end this. Okay, I really need you guys to end this. 15 minutes break when you guys are done with 150 questions. Hopefully, that is a delusion I have in my head. He's obsessive. He's washing his hands all the time. I don't do that too. You know, when there was COVID, we didn't do it either. Did you guys wash your hands every single time? I don't think you did. I'm not sure you did. Did you? I don't know. What's a feature of anorexia nervosa? Yeah, see? We speak the truth only. Okay, reduced growth hormone levels, low FSH, impaired glucose tolerance, low LH, hypokalemia. What is not? It says not. It says not. Not. Sorry. Not. It says not recognized. So you don't read the question because I don't read the question. Good. Why is there impaired glucose tolerance in it? Okay, saying 5. Most of you are saying 5. Let's see if that's correct. That's right. C's and G's, right? Growth hormone, glucose, salivary glands, they are low, right? So here, anorexia nervosa, you should have high growth hormone levels. Okay, high growth hormone levels. Okay. Okay, most things low. What is raised? G's and C's, growth hormone, glucose, salivary glands, right? Cortisol, cholesteremia, carotenemia, all of them is raised. So they're having palpitations, sweating, nausea, overwhelming tremor, woken from sleep on one occasion, afraid they were going insane. What do you want to give them? SSRI, propranolol, or benzodiazepine. What is it they're having? Are they anxious? Are they retarded? Are they depressed? What's happening to them? They've got palpitations, sweating. Because you have a first line. What do you give first line? Panic attacks. Is this a panic attack? How is it a panic attack? You guys have done so much of a panic attack. Is this a panic attack? And if it is so, what would you give her? It's anxiety disorder, okay. What do you want me to do? I need break. What do you want me to do? Okay. Panic attack. Okay. Propranolol. All right. SSRI. Now you see, this woman, unexpected episode of palpitation, sweating, overwhelming terror, right? Woken from sleep on one occasion, was afraid that she is going to go insane. This is what? Is it a panic or anxiety disorder? Firstly, panic attacks are short-lived, right? And they're not more than 20-30 minutes, rarely more than an hour. This is not seen. This is generalized anxiety disorder. This is not a panic attack. Because, you know, in panic attack, a person has a trigger. Is this a panic attack or this is a generalized anxiety disorder? Is this a panic attack or a generalized anxiety disorder? It's panic attack. It's a panic attack. Is it a panic attack or a GAD? You're feeling anxious now. She woken up from sleep on one occasion. She was afraid she's going insane. See, in GAD, what would happen? The person would have problem of all the time, not just like waking up one night and having the symptoms. They'd be afraid all the time, anxious all the time, right? This is not continuous. So this is not generalized anxiety disorder. This is a panic attack. And how do you treat it? SSRI. SSRI. Okay, generalized anxiety disorder. They would have what? They'd have anxiety in multiple ways, excessive worries about different things, heightened tension, anxiety disorder. You always want to exclude hyperthermia, cardiac disease, medication-induced anxiety, right? The triggers could be any of these: salbutamol, theophylline, corticosteroids, antidepressants, caffeine. Okay, so how do we manage a panic attack? Right? This would be where you have palpitations. Please understand this. Palpitations, tremors, sweating, and you can only do breathing exercise. That's going to be fine. Panic attack is different from a panic disorder, right? Right? This is different from a disorder where they would have in disorder at least 2 recurrent panic attacks, at least 2 panic attacks, at least 2 recurrent panic attacks, which are not due to something, right? Like they don't have a medical condition, they don't have substance misuse, they don't have any other psychiatric disorder. This would be also a person having worried about another attack, consequence of the attack, right? They would be such kind of a person. And physical symptoms, signs related to autonomic arousal, for example, sweating, etc., would be there. Concerns of death from cardiac respiratory problems, right? So how do we manage a panic disorder? That is going to be for your part 2, but here you should have at least, for you to say it's a disorder, you should have at least 1 or 2 times. Okay, recognition, diagnosis, the drill, review, maybe involve the mental health team. The person who had here was actually a panic disorder, right? Which is different from generalized anxiety disorder, which is almost all the time. This person would be worried that they have a panic attack, but would be worried that they're going to have another one, right? Maybe they're going to have 1 or 2. Okay, how do you treat it? SSRI is the first thing. How do you manage it? Cognitive behavioral therapy. Okay, agoraphobia, fear of spaces, open spaces, social phobia, social anxiety disorder, claustrophobia, confined spaces, arachnophobia, fear of spiders, acrophobia, fear of heights. Okay, so how do you treat this? If you want to help them with a next episode, beta blockers. right? I hope you guys are following. It's making sense. Okay. All right. For an upcoming event, you want to prevent them from having them now, like in the next one, tripping along. If you want to treat the one going right now, make them breathe into a bag. Okay. Are you guys following me? Good. Last question. We're taking a break for 5 minutes. He is worried because his family was murdered in something big, right? He cannot sleep well, and he's been feeling detached. He describes feeling as if he's watching the world from a misty glass. He feels like he's going mad, right? PTSD is a big thing, right, guys? We're gonna take a break of 5 minutes. We're gonna come back and do this, okay?